So, you've been told your baby has a tongue tie. Now what? Should you rush to get it released? Should you wait it out and see how things go? And how do you know if your provider is the right person to release it? We are going to get answers to these critical questions today on the Breastfeeding with Confidence podcast. Hey, Mama Bear. Welcome to the Breastfeeding with Confidence podcast. Do you dream of bonding with your baby through exclusive breastfeeding, but worry about breastfeeding pain or low milk supply? Maybe you're struggling with breastfeeding and no one seems to have any answers. I'm Jamie, doula, international board certified lactation consultant, and mom of 5, and I have been where you are. After working through painful latches, milk supply worries, and postpartum depression, and supporting countless mothers through their breastfeeding journeys for over 8 years, I'm here to tell you breastfeeding doesn't have to be perfect to be positive. Each week, I'll share breastfeeding tips to help you prevent and overcome unexpected breastfeeding challenges so you can actually enjoy bonding with your baby. If you are ready to shut out the toxic whispers of the world, embrace your God-given intuition, and release your inner fierce mama bear, grab some coffee or your favorite herbal tea and let's dive in. Okay, so before we dive in, I did want to remind you that if you are pregnant and you want to avoid the biggest breastfeeding mistakes and set yourself up for success from day one, or you're breastfeeding, but you're dealing with frustration and discomfort every time you feed, do not miss my live Secrets to a First Latch Without Pain class on April 5th. I am so excited for this. Y'all, we're going to bust myths that I see undermining breastfeeding on a daily basis. We're going to create a breastfeeding success plan so that you know what to do and you're not just going in blind, or you're not navigating the next steps blind. And I'll demonstrate my go-to latching technique that has made breastfeeding easier for hundreds of women that I have worked with. But that's not all. I'm also going to be doing some fun door prize giveaways and a live Q&A session at the end. This is our first time bringing this workshop back to you live in 2025, and I'm so excited for it. I'm so excited to see your faces. I'm so excited for this to be a two-way conversation, and I'm not just talking at you. So make sure you claim your free seat at littlebearlactation.com/secret, or you can click the link in the show notes. Let's dive in. We're going to talk about 5 different important things to think about before tongue tie release today. We are going to talk about the timing. We're going to talk about choosing a good provider. We'll discuss release methods. We'll discuss who performs the release, which kind of goes hand in hand with the provider, right? And then we will talk about pain management and numbing options very briefly. So let's start with timing. So often in Facebook mommy groups, I see people posting, I think my baby has a tongue tie. We're going to go see a provider and get it released. I've got to hurry up and do this. Yada, yada, yada. I've been there. I've been there with my own kiddo where I was like, this cannot wait another minute. If this is going to be the solution, I'm just going to go get it done right now. And with 5 kids, I have personally had that work out well sometimes and not so well other times. Release really is something that should not be rushed. However, earlier is often better. It's not just about getting it done, guys. We want to set our babies up for success. This is why a functional assessment is so important. A functional assessment and preparation for release matters. We've talked about that in some of the other episodes. If you ever work with me one-on-one, I go really deep into exactly why it matters with your baby. Inside of the tongue tie guide in Latching with Confidence, we go super deep into that as well. Function is the most important thing, and release does not always equal function. Okay? It's an important part of achieving function in many, many cases, but it's not the only thing. And it's really important that we don't rush it. However, we don't want to be waiting 6, 8, 12 weeks from when we have identified this tongue tie as a problem, because then we are allowing them to continue compensations. They are laying down neural pathways every single time they feed. And they are basically setting themselves up with really bad habits that are going to be harder to retrain post-release if we are allowing them to continue these compensations right now. So we really do have to find the balance of getting it done as soon as possible without rushing it. The younger your baby is, they haven't had a chance to get into these really bad patterns yet. So you might not need as much of a lead time getting ready for release. For older babies, if they've been established breastfeeders, they're established in really bad habits, they're established with some serious compensations and poor function, it might take a little longer for them to be ready. The only way we know is by assessing function and seeing some level of improvement in tension, in feeding behaviors, in oral function. It'll never be 100% if the release is necessary, but we will get them moving in the right direction. And then we know release is necessary, release is safe, release is the next step. Now, I talk a lot about whether or not your provider, your release provider works well with lactation consultants and how important a team approach is. However, I do want to just let you know having a lactation consultant in their office doesn't automatically make them better. This is really controversial, but something I often see is that I'm working very closely with parents. An initial intake when we work together, whether that's virtually or in person, is usually no less than 60 minutes, often around 90 minutes, depending on how the baby is feeling. We let babies lead appointments, and sometimes babies need a lot of support from mom. And so we have to just take our time, and that's okay. However, when you are working with a lactation consultant in the dentist's office or the ENT's office or the pediatrician's office, it is a valuable resource. Please don't get me wrong. Please don't misunderstand me. However, they often are not doing as comprehensive of an exam, and there is not as much continuity of care. There is not as much follow up. So I have definitely seen it where I'm working with clients very closely, and then they meet with the LC at the provider's office who gives them like a whole different story, but only met with them for 15 minutes. It often leaves parents feeling very not reassured. I've also seen where parents have gone to the dentist before working with me and they didn't release, but they got an evaluation done. And I've seen the lactation consultants there basically normalize dysfunction. I have had parents tell me that the lactation consultant told them to stop breastfeeding so often, so basically limiting feeds, even though extra frequent breastfeeds were the baby's compensation for being unable to remove milk effectively. I have seen lactation consultants in office tell moms that it's okay for your baby to suck multiple times before swallowing because she's just filling her mouth up to swallow. We should have a suck, swallow, breathe pattern. And that's not to say all lactation consultants in dentist office are bad at all. It's to say that when they are giving advice on a poor, when they are limited in their time to do an evaluation, their advice probably is not going to reflect reality. So there's barriers there that we have to be considerate of. So don't assume that just because they have a lactation consultant in-house, that means they're working well with lactation consultants. It doesn't also replace working long-term with a lactation consultant. When my clients are getting releases, I like to see them no less than 3 times minimum because we want to do that initial evaluation. We want to do a readiness check, right? Like, okay, we've got this whole thing ready to go, but let's make sure that they really are ready, that we have seen improvement from where we were to where we are now. And then we do a post visit, a post release, and then we do a post release appointment. That's the minimum, guys. That's for like parents who don't have insurance coverage and absolutely cannot afford care. If you are in a position where you can invest or do have full insurance coverage for support, then you're getting even more. I have worked with parents for 5, 6 appointments to navigate release because it can be a complex situation. So if you're just getting that one-off appointment with a lactation consultant in the dentist office, we're not getting that full follow-up. Let's talk a bit about release methods. There's two ways that a release can be performed. You'll see a scissor release or a laser release. So I want to be very clear that there is no one right way. It is not the tool, it is the provider. So if the provider is skilled at a scissor release and they can do a complete release, a scissor release is not worse or better. Same for laser. I personally tend to prefer laser. It tends to be a little quicker. I think it's associated with less pain. It is associated with less potential for bleeding. And when I say associated, I don't mean scientifically associated. I mean like nervous system perception associated. Like that is how, as a parent, I have always felt. Whereas scissors, as a parent, has seemed barbaric and scary to me. I don't think that they are, but as a parent, sometimes our work brain and our logical brain and our mom brain can have very different reactions to the same thing. And in my mom brain, scissors freak me out. I feel more comfortable with lasers. As a lactation consultant, I just need to know that the provider is doing a really good job no matter what tool they're using. There are providers who do complete scissor releases. In my experience, however, every provider that has done a scissor release on my client has done an incomplete release. And that is just because typically it was an ENT who doesn't specialize in releases, or a pediatrician, or somebody of that nature who just saw an anterior time, was like, oh, we'll just clip that real quick, and didn't actually fully understand how to do a full release. So I do think that's something to consider is scissors aren't bad, but if the attitude is, oh, we're just going to clip that real quick and we whip out the scissors, that's when it's like, oh, maybe not. So don't get too caught up in whether or not it's a scissor or laser release. Do your homework on the provider. Speaking of the providers, who can perform releases? Are we talking pediatric dentists here, a different type of dentist, airway dentist, somebody who works with all ages? Are we going to an ENT? Are we just leaning on our pediatrician for this? There's some nurse practitioners who are qualified to do releases. So what are we looking for? This is a really good question. First, I think it's really important to look for somebody who does releases on a regular basis. Now, there is some controversy over people who label themselves as infant release providers, and that's their entire brand. Some people think that they will just release anybody, and so they are suspicious of going to them, which is understandable. At the same time, working on a baby and working with release is something that I want to know my provider has experience with this. So I want to know that they're doing this on a regular basis, that they understand the ins and outs, they understand the full context. And somebody who is not specializing in that probably has not given enough time and energy to education and ongoing learning to have perspective of the full context of support of how release is supporting breastfeeding. So that's definitely something that I do look for in a release provider, is that they are doing frequent releases on infants. They don't have to completely specialize in it, but it should be something they're doing enough that I know they have sought out extra education and that they have um, a good reputation. And some of my favorite release providers were just very good at communicating. And I think that's really important, is you want somebody who is communicating with your team and who is communicating with you, who's welcoming questions, who is not shutting you down. And this goes for any healthcare provider, right? You should always have a healthcare provider who is welcoming questions, who isn't shutting you down, who isn't making you feel stupid. So I don't tend to say that I prefer a dentist over an ENT or anything like that. I do think there are some really good ENTs out there who do releases, but they have chosen to specialize in that. If you are going to the same ENT who managed your grandpa's snoring issues and your grandma's hearing aids, it's like they're not necessarily incapable, but they might not be the best option either. So my tip is don't just go for who the automatic referral is or who insurance automatically pays for. Do try to invest in somebody who knows what they're doing to make sure you don't have a really bad experience. Pediatricians and releases, ah, it's the same thing, right? The same thing we said before. Pediatricians can do releases. They often will use scissors. They can do a good job if they have sought out the training and expertise. However, if I see a pediatrician did a release, typically it's a very rushed situation. It's, oh, hey, look, we have a tie. Let's cut it right now. And we're not getting the full context. So if they, again, if they haven't gotten the full context, you haven't had the functional exam, you're not sure of everything that's going on and how it's impacting breastfeeding, don't get the release. You can always go back to your pediatrician. You can always say, I'd like to wait. I'm going to meet with a lactation consultant, and then you can go back to your pediatrician for the release if you feel like that's who you want to perform it. Last thing we're going to talk about is numbing options with release, because this can kind of be a controversial topic. One thing that people are afraid of is causing pain during the release, because I mean, you're obliterating tissue. Like, yeah, it's going to hurt. But it doesn't hurt, especially with the laser release. It doesn't hurt in the way that we think it's going to hurt. So a lot of times, I do remember my release. I was 4 years old when I had my release, and I do remember it. I do believe it was a laser release. And I remember being so afraid. They gave me like a little bit of laughing gas, nitrous oxide, the little Miss Piggy nose thing you put over. And then they had me breathe deep, and then they did the release. I remember screaming like a maniac because I was so scared because they did not let my mom be with me. But it was also like 5 seconds of a pinch. Like it wasn't that bad. I can remember it, and it like I feel when I like I just feel like I can feel it in my bones when I remember it. But it was more of a fear response, I believe, than an actual pain response. I also like to point out that when we're talking about numbing the tongue for a release, typically we're using a topical numbing agent. It typically takes about 30 minutes to wear off on average, maybe 15, 30 minutes. Here's the catch. It takes time for the numbing to set in, and most people are not sitting there for 30 minutes allowing that numbing effect to set in. Then it lasts for about 30 minutes, which means the procedure will last about 30 seconds. And if you're going to go latch your baby immediately after and their tongue is numb, they're not going to have proper function. So that feeding is not going to tell you much because they could struggle because they can't feel. That numbing of the tongue is not necessarily going to translate to great function on that first feed after the release. And that's a concern that I have. I feel as if some of the dentists that I have talked to, when we have discussed numbing, I have expressed that I feel like the whole idea of a numbing cream is more for show, just to make the parents feel more comfortable. And they have admitted that they feel the same way. They don't really think that numbing cream makes a difference. It's just to make people feel better. So that's something to consider as well. The experience that finally made me not really put a whole lot of stock in numbing whatsoever is kind of a unique experience. But my son was about 6, and he had to have a lot of dental work done, and he also needed his tongue tie revised, or his tongue tie release revised. So he had to have a second release. He had it done when he was an infant, but he needed it done again at 6 years old. And they did all this dental work where he was numb, and they said that they were going to do the release at the end of the dental work. And to me, that made sense. We were there for the appointment. We had a lot going on. I was literally like 38 weeks pregnant. This baby could come any day. He needed this release done. I couldn't make 2 appointments. We're doing this all at once. That's just how it's going. So they had him numb for the whole time, and he slept the entire procedure. He had a little bit of laughing gas and slept the entire procedure for all the dental work. And then it was time to do his tongue. And he started screaming his head off, like worse than when he was a baby. I was not prepared for that. I was not expecting that. And I asked the dentist, I was like, what the hell is happening? Like, his whole mouth has been shot up with Novocaine. Why is he in so much pain? And the dentist described it like that feeling when your foot's asleep and it's like tingly and numb and it doesn't really hurt. But if you poke it or scratch it when it's feeling like that, it's going to hurt like a bitch, right? That is what he was experiencing. So obviously, a topical numbing agent is different than Novocaine, which is injected. However, it made me feel like, okay, we've gone way on. I'm trying so hard not to use bad words right now. I don't know why I'm in a like cursing mood. We have put so much effort into numbing this kid, and it's actually making it hurt worse. So it does make me wonder, like, if we're using a numbing cream, is it a similar experience where the nerves are just kind of like, what the hell is going on? And they do feel more. As somebody who I'm a redhead and I don't do well with numbing of any kind of anesthesia, I've had personal experiences where I have had all the numbing stuff, topical, injected, all of it, and I still felt everything. And I do believe I felt it more with the numbing stuff there because my nerves were not numbing for whatever reason. They were just on overdrive. So we don't know what our babies are experiencing. So I personally do not prefer numbing your baby for a tongue tie release. It's a 30-second procedure. It sucks, but it's not the worst thing in the world either. And I just don't feel personally that the benefits outweigh the risks. Or it's not like risk, but so I don't feel like the benefits are strong enough to support numbing for tongue tie release. But as a parent, I want you to do what makes you feel most comfortable. If it does just make you feel more comfortable and you can acknowledge that and be like, I don't know if it's the best option, but it makes me feel more comfortable, puts my nervous system at ease. And I understand that maybe it won't reflect, like that first nursing session won't reflect all nursing sessions because she's still numb. And you know that, and you want to do it, fine. That's your right. That is what I want you to do is make those decisions from a place of information and intuition. All right, so you know what to expect during release. You've chosen your provider, scheduled the release. What happens after? That is a whole separate conversation on its own, discussing things like pain relief options, what to expect during the healing phase, how long the healing phase lasts, what the wound might look like, elevations that you might need to do. We are going to discuss all of that in a future episode. I am going to pause the tongue tie series for the next couple weeks, but we will be getting back to it. And we will be discussing how you can make sure your baby gets the full benefit of release with appropriate post-release care. If today's episode helped you feel more confident about your baby's tongue tie journey, let me know. Leaving a podcast review is a great way to let me and other mamas know that you're getting answers to your questions. Also, don't forget to sign up for the live Secrets to a First Latch Without Pain class that is coming up soon on April 5th. It is perfect for both pregnant and breastfeeding mothers who want to enjoy breastfeeding instead of dealing with painful feeds, dreading feeding time, just it being uncomfortable. We're going to get you some answers and hopefully make sure that we can set you up for breastfeeding success. All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.